The freedom of women is an unquestionable ethical value, but limiting a woman's freedom to decide on the product of the pregnancy that is gestating inside of her does not curtail other decisions of her freedom or radically annuls her as a subject capable of deciding on other aspects of her life. Which is why in this topic, we will be focusing on objection of consciousness. In this topic, we will focus on the area health, hence of the gynecologist. Due to this, they rely on the right to object to the administrative and legal obligation that they want to impose, and which consists of ending the life of an individual of the human species. According to treatment of the abortion law during 2021 in media and communication platforms, dysfunctions in Spain abortion laws have resulted in inequality for many women. Although abortion has been a legal service in Spain since 1985, many public hospitals do not perform it and do not report it for years. Patients have to move to private clinics and even move hundreds of kilometers to other cities in order to perform these abortions. Almost all evidence agrees that the conscious objection in doctors impedes abortion rights. This is a case that happened in Chile. I quote, "I asked for an abortion because my son was writhing in pain inside my womb." This case illustrates how conscious objection hinders the application of the law in Chile. Adriana's stories exemplifies the heartbreaking consequences of conscious objection in Chile's abortion laws. Knowing her fetus had no chance of survival, she pleaded with her doctors for an abortion, only to be offered a prayer or the agonizing wait for a stillbirth. After desperate days, the Minister of Health finally facilitated her abortion, but only after 26 agonizing weeks, forcing her to endure labor for a stillborn delivery. A distressing case in Mexico highlights flaws in the legal system regarding child sexual abuse and abortion access. A young girl under 13, a victim of confirmed abuse, was denied an abortion despite having reported the assault promptly. Even the medical evidence of physical violence, authorities failed to offer emergency contraception pills or inform her of abortion rights in case of rape. While Mexican law allows abortion after rape, the judge controversially reclassified the crime as stationary rape, implying consent due to deception. Based on what has been previously analyzed, we can conclude that it is important to inform society about consciousness objection to medicine and how it has affected many women who want to use their rights to abort. As already said, CO, conscious of objection, is a prerogative of the medical professional to oppose the performance of procedure because it goes against their philosophy or religion. But what is important and urgent to talk is, to what extent should we take this conscious objection into account? Some perspectives that will be analyzed in this ethical dilemma will be doctors' different arguments regarding CO, government arguments regarding the legislation of CO, and women's opinion in their rights towards CO. The communicative intention of this research is to let people know how the objection of consciousness in the doctors has impacted the health and rights of women, and if doctors should have the right to apply it. This will be achieved by providing statistical data from various countries on the doctors and people who are in favor and against abortion, and also by reviewing specialized literature. The main resources of this essay are government pages like Human Rights Office of Mexico, Supreme Court of Justice, and Refusal to Treat Patient Does Not Work in Any Country by PubMed Central. These pages are impartial because they work on statistics and are government pages which works on laws. Regarding the perspective of doctors' different arguments regarding CO, it is saying that the patient needs should be met even when a doctor exercises their conscious objections right. It is the right for doctors to neglect services to their patients due to their conscious of objection, but they should not neglect them to a doctor or clinic that provides the service that the patient and or woman needs. A refusal based on conscience arises from the physician's judgment that the outcome desired by the patient is technically unattainable but morally unacceptable. Some counter arguments are that when a person decides to study medicine and become a doctor, they are aware that they are going to have to perform procedures that will be against their values and beliefs. This perspective is influenced by the educational factor. The doctor's values to care for their patients are acquired in their education as they grow up. Talking about the government argumentations regarding the legislation of CO, it is said that it is the obligation of the government public health institutions to guarantee the permanent availability of health personnel who are not conscious objections in the matter. In Argentina, conscious of objection of health professionals has been legally recognized by the government at the national level, which establishes the regime for surgical contraception interventions, where the right to conscious objection is recognized and regulated in the following terms. Every person, whether a doctor or auxiliary personnel of the health system, has the right to exercise the conscious objection without any employment consequences. Consciousness of objection can undermine public health policies, such as vaccination programs or reproductive health care initiatives. This perspective is viewed and influenced by a political point of view. Political events such as strikes towards abortion affect news laws and how government views human rights. UN Women regret that the reform has not provided adequate guarantees so that medical services are never denied, guaranteeing the immediate referral to those who require the service to another provider who can provide it. Some counter arguments towards CO is that not legalizing consciousness of objection means wanting everyone to have the same point of view. This point of view is affected by gender because most doctors and people who are against abortion think that it is the woman's fault for getting pregnant, and it should be their responsibility to take care of the child. Some similarities of all these three perspectives is that they all mention how it is very important that all patient needs must be met. They also mention that it is okay for doctors to have different points of views. However, the government should make sure they always have doctors in hospitals willing to put them aside. Some differences is that they think abortion is a medical procedure that shouldn't cause that much controversy. However, others think that abortion remains outside the bounds of acceptable medical practice purely on ethical grounds. Some consequences related to the doctor's perspectives are that doctors be free to exercise conscious of objection because if they are against doing a procedure, they will be able to have the right to neglect themselves, causing women not to be able to have their right to abort. Some consequences of the government's law regarding CO is that their conscious of objection without any employment consequences will make more and more doctors excuse themselves with this law, causing each time to be less doctors willing to actually perform abortion on women. Some consequences regarding women's perspective is that it may cause a lot of controversy by making doctors think that everyone should have the same point of view. Thank you.